it's Remembrance Day today, and we respect the men and women who have given their lives around the world on all sides for what they believed in and the safety they give us. In the movie we saw earlier, you saw the presence of a Red Cross. It shows the role of medicine in warfare. Most great advances in medicine have occurred through warfare. If you think of Florence Nightingale in the Crimean War, you think of the ambulance being produced in the First World War, driven by Ernest Hemingway in the Spanish Civil War. You think of burns and skin grafting developing to treat Spitfire pilots who were burnt in their airplanes in the Second World War. The material in this submarine is the basis for the nitinol stent used in coronary arteries. There are many things that have come from warfare that, in fact, save our lives, blood transfusions. On the surface of that submarine, you can see tiles. Those tiles feel vibration that are sounds. They travel blindly under the sea at 30, 40 miles an hour, listening quietly. I've had the pleasure of working with a bunch of guys, Pete Neal and others from the ship Nautilus over the last few years. And we've taken these tiles to measure the vibration of cerebral blood flow. So when your heart beats, it pushes a wave, a volume of blood up your aortic arch to your carotids, into your brain, and your brain expands. And it pushes the cerebrospinal fluid against the inside of your skull. A pounding headache. What are you feeling? You're feeling that pounding. It's amazing. That brain is a pump. It drives CSF flow. So we can feel that vibration with these accelerometers that we've taken from that submarine to detect stroke. If you have a stroke, you have asymmetric blood supply. Only one side is moving. It's easy to pick up. Where else is this relevant? If an improvised explosive device goes off and some young men are injured or wounded, you want to triage those who are salvageable versus those who are not. Is this person concussed? Do they have devastating brain trauma? And young medics make a decision in the field to decide who gets evacuated and who don't, who's salvageable, who's not. It's binary. So we can use this in warfare, and we can use this for stroke detection. So we look at this wave of energy that comes from our heart and then drives the brain to expand. And we can create a waveform of that happening. This would be normal. So we're measuring the vibration of the brain moving.